Oh yes, and then Nicole, your hair is in front of your eyes a little bit.
Yeah, I know.
Let it be.
It's on purpose.
Hi guys, and welcome to The Truth Hurts with me, Tony Quinn. The Truth Hurts is a show about recovery and everything in between. And today, if you've been watching the show, you'll notice we're in a different location. And we are at the usual on Grant Avenue, a great coffee shop in Norwood, which is one of my favorites. And if you ever want a good frappuccino, guys, come here. Dude, get a frappuccino. Okay, we're going to get 2 frappuccinos. Anyway, today we have an amazing guest with us. We've got Nicole Germond. Got it, kind of. So I've known Nicole for 13 years now, and she has an amazing story. She's an amazing woman, and she's going to share it with us today. So we're going to jump right into it. Cut. So if you want to take us through a bit of your life and how you got to where you are now.
So really are just jumping right in there.
You're going to I'm sorry.
We're rough riding this. I started my struggles with depression sort of probably around 9 or 10. I wasn't the same as other kids. You know, when you're the outsider and you feel lonely and you're just not really sure of yourself. And I think I was always a very anxious, quite a sensitive child, and I don't think that anybody really took my feelings that seriously. I mean, when you're a kid, people don't think that your feelings are particularly acute. So I kind of withdrew and spent a lot of time sort of inside myself. And as I got older, I wasn't happy, and I was very afraid of everything, and I didn't have a lot of friends, and it led to a lot of isolation, and also being a little bit nerdy, and the geek at school, straight A student, and it manifested itself, and there were obviously incidents and things that we weren't ready to talk about, but when I got to high school, I just wasn't sure what I was doing. I didn't feel like I belonged anywhere, and it was kind of at that point, when you start to feel like you're trying to establish a sense of identity.
Exactly.
And I was just desperately unhappy, and I didn't know what to do with my feelings, and I didn't have any way to. You haven't learned your tools yet to express yourself and to cope, really. So I started cutting myself. That was sort of right at the beginning of high school. I must have just turned 13, and I never told anybody. No one knew about it.
Was it all hidden?
It was all hidden, always. It was something I knew was wrong.
Yeah.
Look, this was 20 years ago. So it wasn't something that was known about yet. I don't even know where I got the idea from, but all of a sudden I felt like I had something that could contain me. These feelings that I didn't know what they were, and this desperation, and I didn't know how to deal with any of that. I didn't know where to put those feelings, and suddenly I had this thing that could really just calm that. I suppose it, in some ways, it's people could see it as a sort of a self-soothing.
Yes, yeah.
But obviously, it being quite seen as quite self-destructive, it tends to get misinterpreted. So it was obviously something that I was quite ashamed of, and I didn't want anyone to know about it, and I didn't, it was not something I spoke to anybody about. And obviously it's hard to hide these things, and that my parents eventually caught wind of it, and there was a lot of fallout, because again, at that point, 20 years ago, it wasn't sort of widely known. It wasn't something that, and mental health in itself wasn't really something that was really spoken about. It wasn't really something that people knew what to do with.
Yeah, especially cutting.
And especially in a 13-year-old, so there was a lot of anger and there was a lot of sort of misunderstanding, and it became very difficult. So it was something that I just tended to hide more and more. I went to see a psychiatrist and a therapist. I got my first bipolar diagnosis at 13.
Oh, they diagnosed you at 13?
At 13, can you believe it?
Wow.
I never put a lot of stock into it anyway, but who diagnoses a 13-year-old? You haven't even developed a personality yet. So I was on medication briefly, but I think the problem at that point was that no one had really stopped to ask me, what's going on. Everyone just reacted, and they shoved these meds at me and didn't really tell me why, and didn't really explain to me, what's happening. So it was all just this sort of emotional, reactive situation, which I don't think was necessarily the best way to deal with it.
Yes, of course.
So it kind of, that's sort of how my high school career went. I was on and off meds. I was sorry, I'm not sure.
Oh, sorry about that. There's a table upstairs being moved.
I was on and off meds. I was in and out of with different psychiatrists. The school was being very reactive to.
So the school knew about it?
The school didn't know about it. And they also didn't know what to do. It was back in the days. We did have a school psychologist.
Yeah, we all had those.
Yeah, I can't say that she and I were friends. We did not see eye to eye. But, they didn't know what to do either. And I didn't know what to do because, the more people yelled at me and the more the more anger I got about it, the more ashamed I got, and sort of the more I internalized it. I ended up in hospital when I was in Matric. It was a long story how I got there, but saw a new psychiatrist who was just awful. I mean, she was just genuinely an awful human being, and I can say that. I didn't know that at the time. I just didn't like her, and she was really quite mean to me. And as an 18-year-old or 17-year-old, you don't respond well to that.
No.
But I had more medication, and I got out of hospital, and then the meds stopped because, again, nothing was ever explained to me, and I didn't really understand what was happening and why I was doing this, and it was all very much against my will. So it's hard to treat somebody.
Were they still working with the bipolar diagnosis?
She actually, I didn't tell her any of that,
and
there was a re-diagnosis, and anyway, so I then left school and had stopped seeing the psychiatrist. I had started, when I was in hospital, I had started seeing a therapist who I actually still see to this day, and I attribute a lot of sort of recovery to her. I've seen other therapists in between and have invariably gone back to her because she and I just developed a good relationship, which I think is very important. But just before my 21st, my best friend was killed in a car accident, and I think that just completely threw me. And I also went on the same route as most, where I just went off the rails, started self-medicating. I was still cutting at that point, and then at some point, I just thought to myself, I can't do this anymore. I was a completely broken human being, and I decided to seek treatment again. This was now psychiatrist number 4, I think, that I saw. And so this was years and years later already. I must have been 25 or 26 by this point. And I started some new medication, also got received the bipolar diagnosis, which again, still don't really believe. But started this new medication and things just went downhill. Every med that I tried, I was starting to have these really strange reactions. Which I thought were side effects, and the psychiatrist thought were side effects. And so she kept jumping between one medication and the next, and it was just kind of clusterfuck, for want of a better word.
Yeah.
And this went on, and then she put me on something that actually, I started to feel slightly psychotic, and I said to her, I can't actually do this, I don't know what's going on anymore, I'm like so hyped up, like I want to crawl out of my own skin. So she's like, no, we need to put you in hospital, because we just need to medicate you, just make sure that you're stable, get these meds that are working, and then it'll be fine. So I was under the impression that I was going to a hospital. Anyway, I ended up in an institution, which...
Within, really?
Yeah, no. Full on one of these,
Yeah.
institutions. You know them.
Yeah.
Been there.
Oh, we were probably there at the same time.
But, I think if I'd gone there under different circumstances, it would have been fine, because, if I had known that this was what I was getting into. But I was completely misled. And
that's terrible. That's dangerous.
No, it was awful. And my psychiatrist kind of just dumped me there, and she was like, "Well, you're somebody else's problem now." And I'm like, "Okay, but I don't want to be here." They took me off the meds that I was on for like 2 days before I actually got to see the treating psychiatrist.
I know exactly where you were.
Completely just like losing my mind. I'm like, I need to leave. They wanted to take my cell phone away. I was like, you must be crazy. I'm not giving you my phone. Anyway, so it's besides the point. But I ended up seeing the treating psychiatrist there, and I said to her, I'm not supposed to be here. I want to go home. And I've sat with this woman for about 2 minutes in this room. She told me a new arsehole.
She laid into you.
She laid into me. She told me that I will never get better. That my other psychiatrist thinks that I have borderline personality disorder, and no medication is going to help me. And if I don't put in the work by staying here, my life is never going to improve. I've never met this woman before, and
she doesn't know your history. Doesn't know
nothing about me.
Like the one thing I always say in regards to that is, I understand a psychiatrist telling you like it is. But I don't understand someone being cruel about it.
She was cruel.
That's the difference.
Walked out of there a broken human being.
Okay, so then we go from there for the next one. Okay, so you were 25, you were in an institution, and this woman spoke to you, telling you basically never going to get better if you don't do what she says.
Basically, it was traumatic. I think. You don't speak to anybody like that, but somebody who's so vulnerable as it is, you end up in a place like that. You are in a very, very vulnerable position, and to have somebody speak to you like that, somebody who you don't know, somebody that has never treated you, that I literally sat in that room with that woman for 10 minutes, and I was a broken person once I left. And I phoned my therapist, and I was just like, what the hell, I can't do this. And so I left. I got myself checked out, and I think the reason why I'm telling you this is it varied. My experience of psychiatrists up until that point had just been very sour. I had not had a good experience of psychiatrists themselves or of medication. It just, there was no reason for me to re-investigate treatment. But through all this time, my mental health had never gotten any better. It was just getting progressively worse. And I think the thing that people don't realize about depression is that it's, whether you're non-functional or you're functional, what really happens is that you lose the ability to deal with the day-to-day stuff. Your resources get diminished, and you get to a point where the smallest thing that happens in your day-to-day life just seems like this unscalable mountain, this insurmountable challenge. I stubbed my toe, and it is the end of the world because you don't have the emotional resources to deal with it. And you just never have a chance to recover those resources. You never have a chance to recoup. Because life just goes on. You've got to get up in the morning. You've got to, pay your bills. You got to work. You have responsibilities as a functional member of society. Well, sort of. But yeah, so my treatments up until that point, this is 15 years later almost, that I've been going through this process, and it had just been awful from the beginning. And I was completely now against the idea of getting any kind of treatment because it had just been so bad. And so I stopped taking all the medication, and around that time, I'd been having all of these side effects, and when I stopped taking the medication, all of these side effects went away, and I thought, great.
What were some of the side effects, if you don't know?
I was getting these very strange rashes, and I was having trouble with my muscles, so I was struggling to use my hands. Like, I'd pick up a cup of coffee and I'd drop it, and it was these muscles here and in my shoulders. My joints were swollen, and it was just some very strange things. I'd go out into the sun and get a rash. I'm Lebanese, I have dark skin. This has never happened to me before. And when I stopped taking the medication, these symptoms kind of went away, and I thought, oh, that's great. About a year later, all of these symptoms started up again, and
you were off the meds?
I was off the meds.
Yeah.
I hadn't been on the meds since before, and I thought, this is odd. So I went off to the doctor, and he's like, no, it's fine, you have an iron deficiency. He tested an iron, and I'm like, okay, well, that's fine. And he said one or two other things, and off I went with my iron pills. Took the iron pills, started to feel a little bit better. But a year after that, the symptoms started up again, and I'm like, this is now something's wrong. And I went back to the doctor. He checked mine again. Mine was fine. So he's like, no, it's fine. You've got like a pinched nerve in your shoulder or something. He legitimately said that to me. I was like I couldn't barely use my arm. I couldn't pick things up. And no, you've got a pinched nerve. So I said, that doesn't sound right. So I went and I found another doctor, and they ran all of these blood tests, and I get this phone call from him. And he's like, listen, your blood results are back. It's a bit of a mixed bag. I'm not sure what to think. So he's like, give me a few days to think about it.
Okay.
I'm like, okay.
I'm like, Google everything.
I'm like, okay, what shall I do in the meantime? So my aunt is a radiologist, and she took a look at the results, and she was like, I don't know what's going on here, but she got me in to see some specialist physician who also did a full physical, didn't know what was going on, sent me off to a rheumatologist, took one look at me and was like, you have lupus. So I was like, okay, that happened. I was at the doctor on my own.
Were you by yourself?
Yeah, I was by myself. I went to the parking lot, and I just sat there, and I'm like, okay, so well, now what?
Did that doctor explain to you what it is?
Because
we've all heard about lupus from House,
from Dr. House. Never lupus, but apparently it is. She kind of did. She said that it's mild at this point, so don't go. Her exact words were, "Don't go onto the internet. It's going to scare you."
Yeah.
So I'm like, okay, of course I'm going to go on the internet. Yeah, but she explained to me sort of what the process is for treating it, and basically it's immunosuppressant. So you crush your immune system, because for anybody that doesn't know,
please, yeah.
So lupus is an autoimmune disease. Basically, your immune system attacks your whole body. It's indiscriminate. It goes, oh, this is a threat. Let's attack this, and so you take immunosuppressants to try and stop it from doing that. But yes, so I started treatment, which is basically chemotherapy, for the same, well, not for the same reason, but one of the things that chemotherapy does is exactly that. It suppresses your immune system. So it's very low dose. It's not like a chemo for cancer, but you do it weekly. And yeah, so I started to feel a little bit better. There were some other meds as well. But obviously, getting a diagnosis of, this chronic condition, it had a pretty severe impact on my life.
I can't even imagine.
I was still struggling physically. I mean, it was getting to the point where I was limping. I couldn't walk properly. My hips I was in a lot of pain. And then there was just the fear that really came with it, because I had no idea what to expect.
Yeah.
The doctors can only tell you so much, because it presents differently in every person. So my fear was, one, am I going to end up disabled? And two, is it going to spread to my kidneys or, my lungs or whatever the case is? So there was a lot of unknown, and my partner at the time had just started a business, and, there was a lot of stress. We'd just bought a house, so we were paying bonds, and he was now running his business, which was a bar. So he was coming home late, and I was trying to deal with this diagnosis. So you can imagine my mental health was not going well at that point.
Well, I would imagine the depression and the anxiety would
it kind of overtook me.
Yeah.
Especially the depression and the anxiety, because the anxiety of the unknown and what is going to happen now, and is my life going to just be over, and then also the anxiety of all the other stuff that was going on in my life, and my partner just didn't know how to deal with it. He was trying to deal with the stress of his own business, and it was, again, just this clusterfuck. So yeah, that went on for a while. I explored different avenues of treatment, and eventually I just kind of got to the point where I was like, I actually just can't anymore. I'm just going to go with it, and just whatever happens, happens. During this time, my partner had just gotten more and more depressed as well in his own right, and eventually everything blew up, and he left. And I didn't really know what to do with this. My entire life had just kind of blown up in my face. I had this very long relationship, and I'd had my health, and then my health deteriorated, and then my relationship deteriorated, and I didn't know what to do.
Literally everything you knew.
Everything I knew was just gone.
Yeah.
I think we take, especially our health, we take for granted until we don't have it. So yes, and then now my partner's gone, and I didn't really know where to even go. So I was staying with some friends, and I was just getting worse and worse emotionally. I was shutting down completely. I wasn't eating, I wasn't sleeping, and my therapist said to me, "You can't carry on like this." She actually then found me a new psychiatrist. She's like, I cannot continue to see you as my patient unless you do this, because I am at the end of what I can do here. So I took that quite seriously, because she was, quite an influence in my life. It was the same therapist I'd been seeing since I was 18, and so I agreed to go into hospital, but a proper hospital this time.
Yeah, and you actually knew
I was very specific, and she's like, no, she's found the psychiatrist, he's at Santon Clinic, and, but it's on condition that you go in, he treats you while you're there, and you stay there and just be monitored, and you need to be fed and stuff, because, I was already underweight by that point because of all the other medication I was on. I'd lost a huge amount of weight, so I ended up going to hospital.
Okay, so you found yourself in hospital for the second time, but this time you knew where you were going.
And I'd agreed to it.
Yes.
Which made a big difference.
Yes, a huge difference, I would think.
Amazing what happens when you actually agree to something. I ended up in hospital. I was there for 3 weeks. I was there for a week, and then I came out and went back in about a week later, because I realized that I wasn't ready to be out again. It was a completely different experience for me. I think having a psychiatrist that I actually liked, and someone who was willing to really listen to me. I think his interest was also with the fact that I had this autoimmune condition and was trying to deal with both of these things at the same time. And then also, I think my family had started to realize that I just really wasn't in a good place, and they were very supportive of this trip to this stint in the hospital. So I did my 3 weeks in the hospital, and it was very beneficial. It kind of just gave me a chance to recover and recoup my resources, and I felt after that I was more ready to face the world, and so it was the first really sort of positive experience I'd had with treatment, and it made a big difference to me. So for the next, how long was it? I think it was 2 years, or next year and a half, I was doing quite well. I was taking the meds, and my physical health was sort of getting a little bit better. And then my aunt had cancer at the time, and she ended up in hospital. And she couldn't walk. She had a blood cancer, and she had a tumor on her spine, and so she couldn't walk, and they put her in a rehab, and she ended up getting pneumonia and had to go back into hospital, and she passed away.
I'm sorry.
When she got pneumonia, by the time she got pneumonia, we knew that she wasn't going to recover, and so we spent it was like a 3-day vigil of we were just all sitting there at the hospital. She was in ICU. I at this point I am in full face mask and stuff because I've got a suppressed immune system, so it was just this horrible situation, and we sat with her while she died, and it really sort of threw me quite a lot because we were close, and it was just a difficult situation. And then, so that was in the September of 2018. In January 2019, I get this phone call. One of my closest friends had committed suicide, and when you just suddenly, you've been doing okay, and then suddenly everything just falls apart, and you just can't cope with your life anymore. So I ended up going back to hospital again for the third time, but at this point I actually didn't know if medication was going to be enough. I didn't know. I was getting worse and worse. I was just getting more and more depressed. I was suicidal, and my psychiatrist said to me, at this point in your treatment, we've tried a whole lot of stuff here. You've been doing okay, and then you weren't, and and it's getting worse now. At this point in your treatment, we need to consider ECT, electroshock therapy, for anybody that doesn't know.
Is that still something?
Yes,
that people
no, they still do it. You go into theatre, and it's all very,
So it's not like where you have to.
Oh no!
Yeah,
I think they do give you a thing to put in your mouth just so this. I don't actually know.
Yeah.
It's not barbaric like.
Yeah. my auntie, when she was younger, she had was diagnosed with schizophrenia, and back in those days, she had the real treatment.
With the head thing. That was still what I thought. Obviously I knew it must have come a long way, but the idea of it just freaked me out completely. And I said to him, that cannot be my last resort here. There must be something else we can do. And he said to me, okay, well, it's kind of a new thing. Not a lot of people are doing it yet, and but it is something that we can try first, which was ketamine treatments.
Oh, this is very interesting, yeah.
So this is kind of really what I wanted to talk about in terms of treatment, because I think a lot of people don't know about it. It's a very newly discovered thing. I obviously then went and did all the research, and because even then, when he said to me, so now these are your two options, we've got ketamine or ECT, and I was like, well, I'm certainly not doing ECT, so we're going to go with the ketamine. I have no idea what to expect. I knew ketamine as a recreational drug. I'd never tried it myself, but it was just something you heard about.
And you get scared when you hear someone say ketamine treatment.
But also you get scared when you hear somebody say ketamine, and anybody that I've ever known that's taken ketamine has told me about the K-hole, where you are basically lying at the bottom of a grave.
Yes.
And that sounds marvelous. Let's do that.
So, when you say ketamine treatment, to me, that's the first thing I think of that. But it's fascinating to hear this.
So when he told me about this, I was just fresh out of hospital for the third time, and so I went and I did the research and I read about it, and there's actually a lot of literature on it. It's been hailed, and look, it's very new, and it hasn't been studied as extensively as they'd like it to be, but the FDA actually pushed it through as an approved treatment for depression. Because what happens is that with traditional antidepressants, you start taking an antidepressant, and the doctor or the psychiatrist is like, okay, so you've got to give it at least 6 months before it's going to start working. With ketamine, it's straight away.
Oh wow!
Like, you will feel the effect straight away. Which in severely suicidal patients is something that you need. You can't tell a suicidal patient, well, you're just going to have to wait it out for 6 weeks or whatever until you start to feel better. And maybe you're going to feel better, maybe you aren't. So
we need to test this one.
But just hang in there.
Yeah. Just give yourself 6 weeks.
Yeah, just put it off. If then you can go ahead. Sorry, it's terrible.
No, it's fun.
But
the truth hurts.
Yeah, I mean, they've really kind of discovered that it's this very, they weren't really sure why even yet, but they discovered in using it, because it's obviously been approved as an anesthetic because it's primarily what it's used for. But they discovered then that people that were having anesthesia, well, having ketamine as anesthesia, were experiencing sort of euphoria afterwards, and kind of led them down this path. Anybody that wants to do the research, there is a lot of literature online. But
I'll actually put a few links below.
Yeah.
So, yeah.
But so I agreed to this ketamine treatment, not knowing anything about it really, other than sort of the very scientific stuff that I had now read. I was terrified, just again because you have these preconceived ideas of what something's going to be, and you just think, I have no idea what to expect here. So I made my first appointment. It was very nicely explained that they've got a sort of a 2-week protocol where you go twice a week for the first 2 weeks, or you see the treating psychiatrist first, and then you do 2 weeks, and then you see the psychiatrist again, and they sort of reassess, and then you start to space the treatments out.
So it's completely controlled environment?
Yes, yeah. It is completely, it's monitored by a psychiatrist, and the treatment center is run by a registered nurse.
Can you tell us the treatment center?
It is called the Infusion Center.
I will put a link.
It's on Bayers, sort of near Rand Park Ridge. The psychiatrist that's running the treatments. His name is Dr. Duncan Rodseth. Yes, so anybody that is interested and has a psychiatrist that maybe doesn't know about this as a possibility, encourage your psychiatrist to possibly speak to Rodseth, for some input as to.
It's good to educate everyone about something.
I think if I had known, if I'd known it wasn't really a thing, 20 years ago, it wasn't a treatment for depression, but I feel like if I had tried this sooner, my life would have turned out very differently. Let me just finish sort of where it got to. So I went and I did my first treatment, which, as it turns out, was nothing like the terror I expected it to be. The most lovely people that run this infusion center, just so welcoming, and just made the whole environment so unstressful. They sit you down, they tell you what to expect. You see the psychiatrist, and then they obviously put your drip in, and it's an hour. The drug is out of your system quite quickly after that. So you do have some. Mostly everybody goes to sleep. I don't know. I don't. But you have some weird kind of feelings in your mind and that. But it's nothing like you're hallucinating, and it's all very, very controlled.
Yeah.
They're monitoring your blood pressure. They're monitoring everything. They're keeping an eye on you the whole time. And it wasn't this terrifying experience like I thought it was going to be.
You can play the last bit.
No, don't. I don't want to hear it. That's all.
Everyone says that.
I'm not going to watch this, right?
You are.
No, I'm probably not. Yes, no. I was just starting at the beginning of this very first treatment that I had, and I think I had such a preconceived idea of what this was going to be. Well, I didn't even have an idea, but when you're dealing with something that you've kind of only ever heard about before as a recreational drug, and now you're just in this situation where you have no idea what to expect, I think it was just a lot. And I went there, and just the loveliest people, and the whole environment was very contained, because there's a nurse monitoring you, and the psychiatrist sees you, and so they have the protocol where it's 2 treatments first week, 2 treatments the second week, and then they sort of reassess, and you kind of see how many treatments you'll need, with the idea that when you start to feel better, you start to spread them out. So you'll have maybe 1 treatment the next week, and then spread them out to every 2 weeks. And and the goal being to find something that's going to work for you. It's obviously very sort of individual, so they can't say, oh, you need to have X number of treatments. It's just going to be based on how you're feeling on a week-to-week basis.
Absolutely, yeah.
I've been doing it for about a year now, and I have to be honest, where for the past 15 years I've been on antidepressants, I've tried everything, and for the first time in my life I can honestly say that something has worked.
That's amazing.
Honestly, it has changed my life. I didn't actually think that it was possible, and I was very skeptical because I'm just a cynic in general. I don't believe anything's ever going to make a difference. But it has honestly made such a difference to my life, and I think that's really why I wanted to talk about it, because I think if I had known sooner, it would have changed things for me. It would have been. I mean, it wasn't an option then, but I think if this discussion can encourage someone, or if somebody didn't know about it and they want to discuss it with their psychiatrist, to give somebody that sort of avenue that there are other options. I think that would have made a huge difference to me. So, I've continued with these treatments, and even my own psychiatrist has said to me, the fact that you have gotten to where you are from where you were, with everything else that you sort of have along with it, with the autoimmune issue, taking these very heavy medications for that, those don't, the medications themselves are not conducive to good mental health, along with the disease itself, so there was a lot to overcome. And he said, that from when I first met you to now, you're a completely different human being. You are motivated again, which hasn't happened in a long time. You're doing stuff you enjoy, which also hasn't happened in a long time. You just are completely different. And I kind of look back on it now, because in the beginning with the ketamine, I wasn't sure.
Yeah, of course.
They keep asking you, are you feeling better? How is it going? Do you want to carry on with these treatments? Because you obviously don't want to continue them if you don't feel like they're working. But I had no idea, I felt better immediately after the treatment, which, as I said before, was the benefit to ketamine, especially in suicidal people. But I wasn't sure if it was like working in the way that I thought it was going to, so it wasn't a magic bullet, it wasn't this, I'd waved a magic wand and suddenly my depression had gone away, and, but in the year that I've been doing it, I look back on this now and I think to myself, what a difference. I feel for the first time, and as long as I can remember, that I have emotional resources to deal with things. And that's really, that's a completely novel feeling for me, because it's, it's been so long that something will happen and I just go, oh God, I can't actually deal with it.
So now if you stump your toe,
it's fine. So I'm going to put a plaster on, and I'm like, oh, well, that happened. My car got stolen in the middle of last year.
Oh, Lord.
I was like, well, that happened. Yes, it was
shit.
It was shit, but I was like, it's not the end of the world, and I can actually deal with this. And it's these little things that you never really think about. An antidepressant or any kind of depression treatment is never going to take you out of a toxic situation. It's never going to fix that. But to just be able to deal with regular things like a normal person, you don't realize that you don't have that until you actually do have it.
Yes, yes.
To not feel like everything is a catastrophe, to not feel like all you want to do is just pull the covers over your head and never get out of the bed again, that has really, really made a big difference. And I really think that the ketamine, don't get me wrong, I am still on other antidepressant treatments.
That's what I was going to ask you. Yeah?
It is a dual treatment, and my psychiatrist said to me, there's no reason to come off of these, because we were doing
with it.
And also we're approaching it from more than one angle, and this is working. We don't want to change this right now, Maybe at some point we can start looking to reduce and that. And I mean, I do tend to agree, and with the ketamine, I don't really know the science behind it. But what I kind of imagine in my own head, and this is just like, don't take me, this is
This is just her opinion.
Yeah, this is my opinion. But from what I understand, when you suffer from depression, you create these very distinct neural pathways. That they're very specific thought patterns that you kind of get into, and they become these like grooves in your brain almost, where you're so conditioned to think in a certain way that that those are the same paths you'll go down like every time. With the ketamine, it kind of lifts you up, and it lifts your brain up, and gives you the chemicals that you need to start creating new pathways.
That's an amazing way to put it.
And I kind of, because everybody's like, how long are you going to carry on doing this for? And I'm like, for as long as I need to, because I feel like the longer that you're depressed for, the harder it is, or the longer it's going to take to create those new pathways and those new ways of thinking, and the more you do it, and the more positivity there is, and the more change there is, the better those paths are going to be developed, and then at some point you won't need the ketamine anymore, because your brain will no longer be functioning in that depressive state.
Because you've gathered those tools and you've learned the tools
exactly.
while on it.
And that's how your brain is now working.
Yeah.
It's kind of just shifted things a little bit, so you're no longer stuck in those depressive ruts. And that's kind of how I've seen it. And I really do just want to encourage anybody. I'm not advocating for it, because I don't think that everything works for everyone.
Exactly.
And I've spoken to some people who it hasn't worked for, but that it really is an avenue worth exploring if you are really struggling and you don't know what else to do, or you're not having success with other medications. And it's also, what I've really liked about it is, and I'm sure you had heard this as well, there are a lot of people sort of experimenting with microdosing now.
Yeah.
What
so
I
that's
like,
with shrooms and...
Yeah, small doses of mushrooms or other hallucinogens, where that's also supposed to help with depression. And in theory, that's it is a good idea, and in theory it works for people, but there is no way to control your dosage in those sorts of situations, because one mushroom is not equal to another. You don't know if what you're taking today and what you bought tomorrow is the same strength mushroom.
Yeah.
So it becomes very tricky. With this, it is done medically. It is done by a psychiatrist and a nurse, and it's all very structured, and I like that. I'm a control freak. I don't want to just be messing around here. Especially with my mental health. Even just trying a new antidepressant, I get so freaked out.
No, it's terrifying.
Because I don't know what's going to happen.
Yeah.
Is it just going to send me into a tailspin? It's been such a long time of just a mess. So that's kind of why I would really, really suggest, if it is something that people want to look into, find a reputable source.
I think... Oh, are you telling us to stop?
I think it's a good.
Just in regards to ketamine, I think Julie has a question.
Yeah, so I want to know, is it like a hallucinogen?
Ketamine itself is an anesthetic. It's used as an anesthetic still, I think, now. It does have hallucinogenic properties as far as I know, but using it as a treatment for depression, they administer it in very low doses.
Yeah.
I think the treatment, the range is like 0.5 milligrams to 1 milligram per kilo or something like that. But
Yeah.
So there is very low doses. So I've never experienced any kind of hallucination. You do get sort of a feeling, a weird kind of floaty feeling in your head, and you have some strange thoughts. And most people that I've spoken to about it, they have like a change in the way that they hear music. It's an odd thing. It happens to me as well. Is that your brain starts to pick out certain parts of the music, and you hear it differently than you would normally.
Yeah.
But those effects are only during the infusion, and strangely you're still very aware of where you are, and that you're sitting in this nice comfy leather armchair, and so anytime you start to like kind of feel a bit strange about like what's going on, you open your eyes and you're like, oh, I'm still here. So you never really feel like that you're seeing people, or some people might see some colors, or it's nothing like a hallucinogenic drug at all. I mean, I'm very afraid of hallucinogens because the inside of my brain is not a happy place.
Same.
This is nothing like that at all.
Oh, that's incredible. And then now that it is treating your depression, and it's kind of given you tools that you can use to cope, and you're learning every day with all those new tools and all those new. I like the way you described the new passageways and the new pathways in your brain and in your thought patterns. So do you feel like this kind of treatment has helped you kind of deal with your physical health at the moment?
Definitely. When everything that happens in your life is a catastrophe, because you don't have the emotional capacity to deal with it, everything is a catastrophe. So now that I can deal with the day-to-day better, and I have the resources to deal with getting out of bed in the morning and doing my work, it does make dealing with my health and my physical health much easier. Don't get me wrong, I still have bad days. There are still days where I just sit and I'm like, what, I'm just going to feel sorry for myself right now because I don't feel well. I'm not okay right now. And, so it's not like everything's just magically like wonderful and I'm,
nothing will ever be
skipping through meadows with bunnies and rainbows. It's not like that. Obviously, I still have a chronic illness, and my brain is still a bit of a mess. But I do just feel genuinely like my day to day, I can actually get up and I can go, okay, this is what I have to do today, and these are the challenges with regard to my physical health that I have to face. I do a lot of physical therapy to try and regain some muscle tone. And then I do the ketamine treatments as well. I go to therapy twice a week. So these are the things that I have to deal with on every week. And sometimes especially when you're feeling depressed, those things just also seem insurmountable. Now I can deal with those things. I can go to the doctor. I can take the medication. That's a big one. These awful medications that make you feel so sick a lot of the time. It became such an issue for me to take them because I just couldn't face it. I just couldn't deal with it. And now, yes, they still make me feel sick, but I just feel like I can deal with it emotionally. I have the tools, and not even the tools, but what I've been able to see in the last year since starting the ketamine is that it's not about treating depression isn't about getting better. It's about making your day-to-day life livable in the best way possible.
Yes.
There isn't ever going to be a point at which you go, oh, I'm better.
Yes,
I no longer suffer from depression. It's about, am I able to cope with today? And then again, tomorrow, am I going to be able to cope with tomorrow? And can I look from today to tomorrow and not go, oh my God, I can't do this?
And now you can. Do you feel like you can?
I can do that.
That's unbelievable.
And yes, there is still the complete unknown in terms of my illness. Like I could die tomorrow. Who knows? But I'm not concerned about it now. Like not to say that I'm not.
No, but I get what you mean. It's not ruling.
It's not controlling my life.
Yes.
It's not every second of every day I'm going, I don't know what's going to happen. I'm so afraid. I can't do this anymore. It's not controlling that. It's now I can look at it from a perspective of, yes, something might happen. But I mean, something might happen to any of us, But I'm not going to ruminate on that, and I'm going to do the best that I can today, and tomorrow is another day.
Nick, I just want to say, for real, thank you for sharing your experience with us. And most importantly, I think a lot of people need to know about different kinds of treatments.
Yeah, I think it's important, because there are other options.
Yeah.
And when you feel so stuck, I mean, look, some people have never even sought out treatment, and I think that's important. I think we've got such a prejudice against the idea of being treated for mental health, and it shouldn't be like that. And I think we're getting better gradually, but if you're in a situation where you are struggling so much, what is the harm in going to see someone, and going to explore the options? no one's going to force you to do anything you don't want to do, but it is worth looking at. And if antidepressants haven't been working for you, there are other options as well. The ketamine really has been a game changer for me as someone who really struggled with antidepressants, really struggled with all of the treatment options. And somebody who has a chronic illness where the medication that I do take is not only makes me sick, but it also not counteract, but there are a lot of negative drug interactions. So my psychiatrist has to be super careful about what he gives me because of all of these other meds. And the ketamine has no impact on any of that. So
you found something that works.
That works for me.
For you, yeah.
Exactly. And I think that the point is, don't give up.
Because you can find something.
Eventually, look, it's not. None of this is a quick fix. Depression or any kind of mental health issue, they are long-term problems. They are, but you have to work at them every day. And I think that that's also something that people don't really think about. It's something that's got to be worked at every day, and not every day is going to be a good day. It's absolutely not going to be a good day. But even if you didn't have a mental health issue, it's life.
It's literally one day at a time.
Absolutely.
When I first walked into Narcotics Anonymous, the first thing I saw on the walls was one day at a time.
And
bro, I was like, these assholes, these pretentious assholes. But it's true, and I think it's true with depression. I think it's true with eating disorders. I think it's true with every kind of illness that you can't actually physically see.
Yeah.
And for me, I live my day one day at a time.
Yeah.
And specifically for you, I think everything you've said, you face mortality, you face depression, and you have figured out your own way to cope with it.
Yeah, absolutely. And it's your way to get through your day to day.
Yeah.
And also I think realizing that just because today isn't a good day doesn't mean tomorrow is not going to be. That's been a big one for me, because I think especially with depression, you get so bogged down in what you're feeling right now, is that it doesn't seem like there's ever a possibility that tomorrow is going to be better. And maybe it won't be, but maybe it will be, and how you feel right now shouldn't dictate how you feel like tomorrow is going to be, if that makes sense.
Yeah, 1 minute at a time.
Exactly.
I love this. I'm so happy to have you on the show and to share your story. I used to be petrified of you, hey? I was so scared of this chick. I was so intimidated by you.
That's so funny. I don't know why.
Dude, I don't know.
The least scary person ever.
I was petrified. But I'm so happy to have you on the show and have you share your story. And that was very raw and very honest. And I know you probably don't want someone to say, oh, you've been through so much, but you have. Mm-hmm. And I think we all have in our own way, but you've got a lot of strength in you. And I think sharing the ketamine treatment, therapy, all those things that work for you can work for someone.
The thing that I didn't touch on, that I actually would still like to, is reach out. That for me consistently has been a problem in my life. It's been a problem because when I get depressed or when I get unhappy, I tend to withdraw. Because I don't want to be a burden to those people around me, and it's taken me a long time to learn, and I'm still really terrible at it. But reach out. The time that I have been the most successful with my treatment has been when there have been people around me that I trust, that are working with me and that are helping me. The people at the Ketamine Center. I've got this really great physio that helps me. I've got a really great therapist. Reach out to those people. Find people and surround yourself with people that can help you and that can do what needs to be done. Don't be afraid to ask for help. That is, trying to deal with this stuff on your own is the quickest way to fail.
Yeah.
You need support.
That's that's the thing that I really want people to know, and you've just said it, is that you're not alone. There are people that do want to help. Yeah. And you know what, it sounds like the end of the world. You don't want to put your problems on other people, but it's okay to.
It is, and also, you don't want to bury other people under your problems, but they can help you find the right people to deal with those problems.
There we go.
You do need professional support. You need both. You need your family and your friends, or your support structure, whatever that looks like. you know, your personal support structure, and then you need the people that are you know, they're there specially to help you with these things. You need both of those things. And also, you know, you don't want to bury your family, so that's why you have these people.
That's so important. That is so important.
But that doesn't mean that you can't rely on your family or your friends or whoever your support structure is, and, you know, to support you through that process of getting help. And, you know, so I think it's also I think a lot of people go, oh, well, you know, I'm depressed. You know, so I'm just going to use that as an excuse now. You get to make a choice. You get to make a decision to seek help. You get to make a decision to face every day and go, you know what, today I'm still going to try. I'm still going to go and see my doctor. I'm going to take my medication. You know, doesn't matter how bad I feel, or I'm still going to make that decision to do it. You know, you can't think yourself out of depression, but you can make a choice to do something about it.
I want to say that kind of stuff, but I don't know depression well enough to say it, and I think that's one of the most important things, and that's something that I live by, is you do have a choice.
Yeah.
And as difficult as it seems, you can make those choices and try.
Exactly.
And I think that's what we can definitely learn from.
Yeah, no, absolutely. And don't let it control you, you know. It controls your brain enough. Don't let it control your actions as well.
Guys, thank you so much. Thank you so much for being here and for sharing your story with us. And you are, I know it sounds pretentious, but you are really an inspiration. And thank you. Thank you so much, Nicole. And guys, thank you. Please let us know what you think. If you want to know anything more about ketamine treatment, we will put some links below. And just know that it is okay to seek help and try different things for your own well-being. And Nicole has taught us that. So thank you again. And guys, thank you for watching, and we will see you in the next episode. Peace. Thanks, Jules. Jules is clapping. Ryan is, yeah. Hey.
Awesome.
Oh, that's so
That's so cool.
That was cool. Hey? It's nice, so nice to learn that kind of stuff. Sorry, it's really important to me, like, and I'm really happy you said that, because like when people say things like therapy doesn't work, and like blatantly, it upsets me.